Australia will ban imports of single-use vapes from January. That's according to Health Minister Mark Butler on Tuesday, and marks the first step in a crackdown aimed at curbing the growing popularity of the nicotine-filled devices amongst young people. Butler said the ban will be expanded in March to include all non-therapeutic vapes, including refillable devices.
These are the vapes that are deliberately sold to our kids. These are the vapes that have pink unicorns on them, bubblegum flavouring, disguised in order for them to hide them in their pencil cases. This is not a therapeutic good to help hardened smokers kick the habit. This is a good that is deliberately targeted at our kids to recruit them to nicotine addiction and then to cigarette smoking.
Despite one of the lowest rates of smoking in the OECD, a group of mostly rich countries, vaping in Australia is growing rapidly, especially among the young. Government data shows around 1 in 5 people aged 18 to 24 vape. Importers of vapes for medical purposes will need a permit from the Office of Drug Control, Butler added. The government has announced almost $50 million in extra funding for the Australia Border Force and the Therapeutic Goods Administration to enforce the rules. Additional legislation next year will apply the same prohibitions to domestic manufacturers. To ensure the bans don't limit access for smokers looking to quit, doctors and nurses will be given expanded powers in January to prescribe therapeutic vapes where clinically appropriate. However, therapeutic vapes will be restricted from using flavours and will have limited nicotine levels.